My name's Gershon Kutsi and you are watching Melomed TV. When we started this platform, we decided to bring you healthcare information that is simplified yet informative. Now, World Cancer Day was observed on the 4th of February, and we chatted to three of our specialists and our Oncology Unit Manager who shares her experience after being diagnosed with stage 1 breast cancer.
So I think with breast cancer and with any cancer in general, I think it's a very scary moment, the moment you're diagnosed with cancer. And my role as a specialist and as a surgeon is to try and make you comfortable as the person who's been diagnosed, not just you, but just your family as well. And I think, it's important that we take the step together, from the moment you walk through my doors to the moment we get to theatre and to the moment we get afterwards. The most important thing I think to remember is that, we are available as a group of specialists, we are available as a group of nurses and cancer practitioners that we can actually do your treatment once you've been diagnosed. And also the other important thing to remember is that it's not a death sentence. That's something that we always emphasize, that the moment you've been diagnosed, it means that at least we know what to do and we can go ahead and go and do whatever needs to be done at that point, be it surgery, be it chemotherapy, or a combination of the two.
I qualified as a registered nurse in 1989, and I've been working as an oncology nurse for 28 years. In 2021, I had a life-changing experience when I was diagnosed with breast cancer. And it's been a challenging journey, life-changing journey to me. I've had surgery followed by radiotherapy. The journey is scary, challenging, but I can say you can do it. It's possible. Don't be scared. There's support there. You can do it. So travel that journey. It's worth it.
The journey of cancer is a very intricate one and emotional one as well. And a lot of patients, when they hear the C word, they still feel very, very inundated. They feel like the world is crashing. But that's not necessarily the case these days, because we always promote that the earlier the stage, the earlier the detection, the better the outcomes. So with women with breast cancer, for example, they come in earlier, they get their diagnosis earlier, and the results are much, much better that way. We do have a multidisciplinary team approach with Dr. Makoba, Dr. Najjar, myself, and we always work as a team together. But one has to bear in mind that surgery is only the first part of cancer. We still follow on in sometimes with chemo, sometimes with radiation. And rightly so, it's a journey. So we are here, Sister Zelda, myself, Sister Claude, and we're here to provide the best emotional support for our patients and physical support as well.
There are a few options when it comes to reconstructing the breast. And I like to divide it into three sort of subcategories. The one is an implant-only recon, where synthetic tissue is used to reconstruct the breast. And the other form is an autologous recon, where the patient's own tissue is used to reconstruct the breast. And then there's a sort of hybrid of the two, where one uses an implant, but in addition to an implant, one then augments the volume with some form of flap or patient's own tissue. The reconstruction could be performed either in the immediate phase, which is at the time of the actual mastectomy, or further down the line.